Hey guys, got a higher USMLE question for the renal system. This is completely applicable to step 2 CK and also applicable to step 3. So we always start with the last 2 to 3 sentences. Urinalysis shows red blood cells and proteinuria. ECG shows ST-T wave non-specific changes. Serum potassium is 4.5 milliequivalents per liter. What is the next best step in management of the patient? So a 40-year-old female with elevated blood pressure more than 160 by 90 millimeters of mercury, family history of renal failure. She has occasional episodes of pain in her flanks, but attributes this to muscle tension. Heart rate is 88 beats per minute. Urinalysis shows red blood cells and proteinuria. ECG shows ST and T wave non-specific changes. Serum potassium is 4.5 milliequivalents per liter. What is the next best step in management of this patient? So first of all, guys, I want to tell you guys the lab values. We have to take off our training wheels here, okay? Potassium is normal 3.5 to 5 milliequivalents per liter. The urinalysis shows red blood cells and proteinuria, and ECG shows ST and T wave changes. These are all abnormalities. They should normally not be present in any patient. Heart rate here is completely normal, and blood pressure. Okay, let's get into blood pressure. Very important for family medicine, internal medicine topics. Okay, what is normal blood pressure? Normal blood pressure is 119 or below and 79 or below. Elevated blood pressure is going to be between 120 to 129, and anything and diastolic we're going to be speaking about 79 or below. Now stage 1 hypertension, where we have to add in a drug, that's going to be 130 to 139 and 80 to 89. Stage 2 hypertension is 140 or above, and stage 2 is going to be 90 or above. This is not according to my definition. This is according to American Heart Association. I'll make sure to keep their photo in the description. So let's now go choice by choice. Check serum metanephrines, wrong answer. Okay, so check serum metanephrines is essentially going to be, you're going to be getting more, that's going to be in pheochromocytoma. So pheochromocytoma, guys, recall we're going to have the 6 P's, okay? Pain, pressure, palpitations, perspirations, paroxysmal increase of hypertension, and pain, pressure, pallor, paroxysmal palpitations, and I'm sure there's a 6th one, but it's not too important. So your blood pressure is going to be elevated, but in paroxysms, okay, we're going to have palpitations. So she doesn't have high blood pressure here. She didn't complain of any sweating, palpitations, so this cannot be the answer, but it is completely applicable. This is a really important point, especially when we're looking at CCS cases for step 3. We want to keep this in our differential of pheochromocytoma, okay? Especially because she's having flank pain and all that stuff, but it's a wrong answer here. She does not have you wouldn't see the ECG changes here, and it wouldn't be like this. Let's come to option to obtain 2 weekly home blood pressure measurements. That's completely wrong over here, guys. Look, she has high blood pressure. She has stage 2 elevated blood pressure. She has also like all this type of family history of renal failure, so family history is really significant. She's having flank pain, so we don't want to do 2 weekly home blood pressure measurements. I'll just come to the description and check what they're saying over here. So to obtain 2 weekly home blood pressure measurements, that's wide core hypertension. The patient has a lot of long-term changes, ST and T wave changes, proteinuria, red blood cell, and bilateral flank tenderness, fullness. We don't want to we don't suspect wide core hypertension over here. All right, let's measure plasma renal activity. That's wrong answer, guys. Why? If we're gonna have renal hypertension, we're thinking about secondary hypertension. Okay, over here your potassium is gonna be abnormal. Over here potassium is gonna be normal. Why? Because essentially you're gonna get low blood flow. That's going to trigger your jugular apparatus, and that's going to be leading to your basically increased amount of aldo. Okay, so you can get low sodium. That's going to be less triggering your jugular apparatus, less stimulation of macula densa, and that's going to be stimulating your renin. You're going to be basically getting more and more renin, which is going to secrete your adrenal cortical secrete aldosterone, and that's going to be basically reducing your potassium by affecting the potassium in the principal cells of collecting jugs. I'll get into details with this in the description. You can, of course, check my website for more stuff like this. All right. Then I want to come over here to obtain renal ultrasound, which is the correct answer. Guys, it's very obvious. She has a family history. She has high blood pressure. She's having changes. It's going to be adult polycystic kidney disease. We want to measure a cyst in the kidney. So that's essentially the correct answer over here. Choice number E, educate about lifestyle modification and follow up within 6 to 8 weeks. Guys, that's a wrong answer over here, although very applicable, but her blood pressure is 160 by 90. We spoke about the levels of blood pressure. And this over here, guys, is going to be stage 2. Stage 2, you want to add a drug, you want to find a diagnosis, and she has family history, she has bilateral fullness, this would not be the best step in this scenario. Guys, just want to recap. This is a female who has a family history of renal failure. She has very high blood pressure, 160/90. Normally we should be at less than 119 and less than 79 for normal blood pressure. Then we want to do then we want to come over here, and she has some urinalysis changes, so that's where we're thinking adult polycystic kidney disease, and we want to do ultrasound, and then we may want to give a ACE inhibitor for decreasing the amount of angiotensin in the stream and decreasing blood pressure. So hopefully you guys found this video. Thank you guys so much for watching, and I hope to see you guys next time.